Hi there, it's Travis from AcuHealth Hub. Lately, I've been seeing a lot of questions come up in the group about gut dysbiosis. Let me start by asking you a question. Are you experiencing widespread body pain, joint pain, chronic fatigue, or brain fog? How about sleep disturbances, mood fluctuations like low mood or anxiety, perhaps food intolerances or sensitivities, or even digestive issues like bloating, nausea, constipation, diarrhea, abdominal pain, or cramping? If the answer is yes, then you're most likely experiencing gut dysbiosis. So gut dysbiosis, it refers to an imbalance or disruption in the composition of gut microbiome, which is the diverse community of trillions of microorganisms, bacteria, fungi, viruses, and other microbes that are essentially living in the digestive tract. Normally, these microbes work together to support digestion, the immune system, and overall health. However, when the balance of good versus bad bacteria is disrupted, it can lead to health problems. So, what are the causes of gut dysbiosis? Well, one of the major things is poor diet. So, diets high in processed foods, sugars, and unhealthy fats can negatively affect the gut microbiome. Antibiotics. While antibiotics can kill harmful bacteria, which is a good thing, they can also wipe out beneficial bacteria, leading to an imbalance. Interestingly, chronic stress. Stress can negatively impact gut health by altering the composition of gut bacteria. Lack of fiber. Fiber-rich foods feed beneficial bacteria, and a low-fiber diet can starve these important microbes out. Also, infections or illness can disrupt the balance of gut microbiome. And lastly, environmental toxins. So, exposure to pollutants, pesticides, and certain chemicals can all harm the gut microbiome. Now, there are several effects of gut dysbiosis. So, when the gut microbiome is out of balance, it can actually contribute to a range of health issues, including fibromyalgia, chronic fatigue syndrome, irritable bowel diseases like Crohn's or ulcerative colitis, inflammatory bowel syndrome, rheumatoid arthritis, mental health disorders like anxiety, depression, and it can even exacerbate symptoms of post treatment Lyme disease disorder. So, there is actually a lot a person can do to help address this gut dysbiosis. To restore gut balance, a great place to start would actually be looking at probiotics. So these probiotics, they're live beneficial bacteria found in fermented foods or supplements. We also want to consider prebiotics. These are the non-digestible fibers that feed beneficial bacteria. So we'll be able to keep those probiotics alive by considering the consumption of high fiber foods that are non-soluble. We also want to consider dietary changes, so emphasizing whole, unprocessed foods that are rich in fiber, fruits, vegetables, and fermented foods are all a great thing. And we also want to reduce things like sugar, processed foods. Limiting these can actually prevent the overgrowth of harmful bacteria. And interestingly, we want to manage stress. So techniques like meditation, qigong, regular exercise, adequate sleep, these can all actually help regulate gut health. Now, addressing gut dysbiosis is truly important when working on overcoming complex chronic health disorders, things like chronic fatigue syndrome, fibromyalgia, rheumatoid arthritis, inflammatory bowel diseases, or irritable bowel syndrome. But, interestingly, it may not actually be the very first place an individual should start. In AcuHealth Hub Methods and Guidance group, I help people understand the importance of going through an order of operations to truly reclaim their health and vitality. This starts by addressing the immune system, followed by digestive system, which is where repairing the gut dysbiosis comes in. Then we look at the neuroadrenal system, and lastly, circulatory system. So, if you'd like to learn more about the AcuHealth Hub methods, join our free group. The link can be found in the bio. Now, if you have questions and want to engage, please drop a line down in the chat. But for now, let's get your health back on track. Take care.